Hello, I'm Dr. Jeff Zwiren at Primus Center for Plastic Surgery. In this video, we'll discuss abdominoplasty surgery. Now, abdominoplasty or tummy tuck is one of the most popular body contouring procedures. The procedure helps our patients achieve a tight, flat abdomen. The procedure itself removes excess abdominal skin and excess fat, utilizing an incision just above the pubic bone, similar to a C-section but longer. Women who have given birth or have lost a significant amount of weight may find themselves left with a loose, stretched out midsection. No matter how much exercise, what type of diet, or what kind of cream is applied, the redundant skin never seems to go away. The skin has lost its elasticity and can no longer shrink back. A properly performed abdominoplasty will remove the redundant skin and significant portion of the stretch marks. This is an operation that has a high degree of patient satisfaction. The scar, when properly placed, will extend across the lower abdomen just above the pubic area. When artistically placed, the scar is easily hidden by a bathing suit or underwear. There are many modifications of the abdominoplasty. The most appropriate procedure for you can only be determined at the time of an examination. We need to check your skin excess, skin quality, fat excess, fat distribution, and body type. Together, we'll discuss your goals and match you to the correct procedure. We must consider the three components that create the abdominal problem and determine how each one must be handled. We must assess skin, fat, and muscle. If there's loose skin of the abdomen, this will need to be removed. This is most easily assessed when sitting. If the muscle layer is loose, then this will need to be tightened. Take a moment and look at yourself in the mirror and identify what bothers you. Be specific about what features you would like to improve. And abdominoplasty does an excellent job in eliminating the abdominal bulge. In addition to removing excess skin and fat, we also tighten the underlying muscles to flatten the stomach and narrow the waistline. Any stretch marks below the umbilicus will also be removed. A properly performed abdominoplasty will help create an hourglass waistline. Many times additional contouring liposuction will be needed. This may include contouring of the hips and posterior flanks. For safety reasons, overly aggressive liposuction should be avoided. Liposuction can jeopardize the abdominal blood supply and can lead to wound healing problems. An abdominoplasty creates a scar from hip to hip and requires repositioning of the umbilicus to avoid positioning it too low on the abdomen. Abdominoplasty is performed under general anesthesia and usually lasts 2.5 to 4 hours depending upon your size, shape, and amount of contouring that must be done. An estimate of the length of the surgery will be provided to you at the time of your examination. Typically, the procedure can be done as an outpatient. Some patients may require an overnight stay. Again, we will discuss this as well at the time of your consultation. An abdominoplasty can be done in our office operating room or in the outpatient area of the hospital. We use only board-certified anesthesiologists. Blood loss is typically minimal. It is important to stop smoking prior to abdominoplasty to reduce your chances of wound healing problems. We encourage our patients to start walking as soon as possible to reduce the risk of blood clots. Pain after surgery is managed using oral narcotics, and you'll be placed in a post-operative binder. The binder helps contour the soft tissue and helps to reduce swelling and bruising. You'll be able to gradually increase your activities over the first 7 to 10 days. After surgery, you may expect to limit heavy lifting for the first 4 to 6 weeks. After 10 days to 2 weeks, most patients are able to return to work. The results of an abdominoplasty are expected to be permanent. Future pregnancy or sizable weight gains can change the results. Swelling may be present for the first 3 to 6 months. As with all plastic surgical procedures, it is important to understand the operation as well as potential risks, complications, and benefits. If you have any further questions about this procedure, please visit our website at primuscenter.com. Thank you. At Primus